Welcome to the last episode of our 5-episode series of the Serving Wellbeing podcast. In the last episode, we talked about wellness programs that actually work, programs that were implemented into restaurants and offered help with mental health and substance abuse. In this episode, we are proving that these programs work and are effective. In our last episode, we talked about wellness programs like Amuse and YIW and how implementing these programs can positively impact the restaurants. Starting with Amuse, the paper, a pilot study of a mental health education program for restaurant employees, talks about the successes of the program. In their research, author Andrew Muth implements this Amuse program into multiple different restaurants. The results showed that this program was feasible, meaning it could be implemented easily. When talking to employees, they found that this program was also seen as acceptable, meaning that workers found the program to be useful. After talking to the employees, they found that this program improved self-efficacy, which is where the individual believes in their ability to seek out help with their mental health. This program also increased the amount of people who actually did go out and search help. Being able to seek out help for mental health is something that a lot of people can't do or don't want to do. This could be due to the stigma behind mental health in the world or people not having access to these resources. However, getting people to get help improves the business in multiple ways. One of the things it reduces is burnout, since employees get to vent and get help for their mental health issues caused from the workplace. Another thing it improves is workplace performance due to the fact that having good mental health can make you more efficient. The employees also engage in work more since they find their work environment more acceptable and sometimes fun to work in if they don't associate work with negative emotions. However, there are some limitations to this program as it was just in its testing phase. The stigma issue on mental health wasn't significantly affected, meaning that some people that were included in the program didn't believe in the need to seek out help for their mental health. Also, since it was a small sample, there may not have been enough time to determine long-term effects. This brings them and many researchers to the conclusion that a long-term experiment is needed in order to confidently answer these issues in the food industry. This is where future researchers can go with this idea, implementing one of these programs across multiple restaurants for the long term to study its effects. Another paper that echoes Amuse is the paper Young Adults in the Workplace, a multi-site initiative of substance use and mental health. The program in this paper is called Young Adults in the Workplace, also known as YIW. This paper also showed the feasibility of the program, showing that not only Amuse but a lot of these other mental health programs are easy to implement into the food industry. They also found that the young adults engaged with YIW plenty of times, also highlighting the acceptability and engagement of this program. Since this program focuses on substance abuse as well as mental health, we can see a slightly different result in this paper compared to Amuse. This result was that the prevention program within YIW reached the young adults and can influence their decisions. The program was also spread among diverse industries, yet they could find ways to implement it in these different places, which included the food industry. It's important to look at limitations to see where improvements can be made, and this paper is not immune to that. Due to the diverse industries, the outcome varied, so possibly for future research, there should be a focus on one or two industries to make it easier to monitor. The program isn't 100% effective, as in some places it emphasized the processes, which include feasibility, acceptability, and engagement, and the potential to help, rather than the actual outcome of implementing the program. Just like the other paper, the time constraint is another limitation. There is a need for a long-term study. After researching these papers and many more, there is no reason why there shouldn't be programs like these implemented into the workplace. They are feasible, they are acceptable, and they are engaged in by the employees. There's also almost no downside to implementing this program, because even if it doesn't help some people, it will help the others who need it. The cost is also reasonable. In the YIW paper, the low-intensity program cost around $68 per employee, while the high-intensity program was around $366 per employee. There is a need for these programs in all workplaces, especially the food industry, where most younger people work, in order to improve overall well-being and business efficiency. Thanks for listening to our 5-part series addressing our question, what specific mental health initiatives can restaurant managers implement, and how can these programs be shown to improve employee morale, reduce turnover, and increase overall workplace efficiency? We appreciate you listening, and hopefully this will help inform you future managers.